The news day continues here on One News Now. I'm Riza Diaz. The Health Department reports over 5,700 new COVID-19 infections. That brings the country's case tally to over 1,143,000, some 54,900 of which are still considered active. The virus claimed the lives of 140 more patients in the past 24 hours, pushing the nationwide death toll to more than 19,000. Now, total recoveries increased to 1,069,000, with 7,500 more survivors logged in the past 24 hours. The OCTA research group says herd immunity may be achieved this year, at least in NCR. In an interview here on One News Now, research fellow Guido David explained that the government's timeline is feasible considering the amount of COVID-19 vaccines set to arrive in the country in the next few months. Vaccine czar Carlito Galvez said they aim to immunize Metro Manila residents against COVID-19 by November.
The supply side is one part of the equation. The other is how fast can we actually vaccinate people, and how many people can we vaccinate every day. So it remains to be seen.
David, meanwhile, reported that Zamboanga City and Cagayan de Oro continue to see a rise in COVID-19 cases. He also warned about the high positivity rate that can be found in Puerto Princesa, Palawan, despite lower numbers in the past few days.
We're actually concerned because we're seeing a 77 positivity rate in Palawan, and this is concerning because perhaps they're not testing enough right now.
Many were alarmed after Seychelles, the most vaccinated country in the world, reported a surge of COVID-19 cases. But authorities there say that the spike seems to be easing now. Let's watch this video from Bloomberg.
The Seychelles, being one of the most vaccinated countries in the world, 60% of the population has been vaccinated so far. We have recently seen a surge in COVID-19 cases. We are all wondering if the vaccination campaign is working. Speaking to the President of the Republic of Seychelles, he stated clearly the vaccination campaign has and is protecting us from this pandemic. Since the 25th of March, Seychelles opened its frontiers, and since then we have been welcoming tourists coming from almost all parts of the world. Yes, local transmissions are happening, and we are having very rare transmission in the tourism establishment. Tourism is the backbone of Seychelles' economy, and we need to open our frontiers to let tourists come on the island. Currently, we have 40 people admitted at the hospital and only 2 needed intensive care. As the President, stated, Seychelles is equipped to deal with the pandemic.
A public health expert and virologist says vaccines are clearly working against COVID-19 as they hope that more people will get vaccinated in the coming days. Let's get more details from this Bloomberg report.
Obviously, this is a fantastic way to encourage people to get vaccinated, tell them that they don't have to wear masks as much. Is it also risky? Just 6 weeks ago, Dr. Rochelle Walensky was warning about impending doom.
I think we have to balance the idea that we want to show people that there are going to be benefits from getting vaccinated. We have to balance that with the fact of we still want to control this virus, and there are still many parts of the country that have rates of virus that are too high. But overall, the vaccination campaign, probably combined with the warm weather that's coming, has resulted in a pretty dramatic reduction in virus spread here in the U.S. And we need to power through. People have mentioned this 70% of the adult population number. We need to continue to power through and get to as high a level as possible. And hopefully this is one of those things that will help us get there.
I must admit I'm excited about the prospect of not having to wear a mask all the time. But at the same time, I also cast a nervous eye toward India, toward the UK, where the variant first found in India is spreading. Should that make me nervous, even if I'm vaccinated?
Well, I like to think of things in two ways. In terms of the general public, you shouldn't be worried right now. The vaccines that are here in the U.S. are covering all the variants that we've seen right now. The situation in India, it's a tragedy of the exponential proportions. But what's going on in India sort of mirrors the other things that are going on with variants in this country. Those are things that keep me up at night, or in this case, maybe get me up early in the morning, because we as scientists want to continue to monitor this virus, see how it's changing, and look for those changes in the virus that are causing it to be either more easily transmissible or evade vaccine immunity. But right now, the vaccines that we have here in the U.S. are working really, really well against all variants out there. So the general public right now shouldn't be concerned about this. They should just continue to get out there and line up to get those vaccines in their arms.
Andrew, I'm so excited to have you, especially on a day like today. So thank you so much for waking up early for us. When you look at what we know about the vaccines, so they protect you. They have a good efficacy rate. If I catch it, because people are still testing positive even if they're vaccinated, can you still pass it on to someone? Do you transmit it without catching it yourself?
Yeah, this is some of the great data that has come out since the clinical trials. It certainly looks like, particularly in the case of the Moderna and the Pfizer vaccines, that you're much less likely to get infected and pass the virus on if you're vaccinated. We're seeing a focus on the cases of people who are vaccinated and gotten infected, but we really have to put that into context and compare it to the millions of other people that have been vaccinated and have not had any signs of infection. So I think these vaccines have really come out to be fantastic, probably better than I would have ever hoped to have been in terms of protecting against severe disease, regular symptomatic disease, and now we're seeing the data that says it's even protecting from transmission. So things are working. It's still not a bad idea to have a mask around. Groups are always an issue still right now because you want to make sure that you're not coming into contact with large numbers of unvaccinated people. But these vaccines are really working, and that message really has to get out there to the general population. They're safe and they're efficacious, and they're turning the corner on this pandemic, at least here in the U.S.
Now, here are other stories we're keeping our eyes on. House Majority Leader Martin Romualdez has vowed to defer the impeachment complaint against Supreme Court Associate Justice Marivic Leonen. Chairing the Committee on Rules, Romualdez said the impeachment complaint will be included in the order of business for referral to the House Committee on Justice. Recall that the complaint accuses Leonen of failing to file his SAL-N when he was a professor at UP. Senator Joel Villanueva is urging authorities to use the 20 billion peso unused calamity funds to finance the immediate repair of PGH. The senator says the unused calamity funds could also be used to jumpstart the efforts in improving the state-run hospital. And FIVOLCS reports 11 volcanic earthquakes in Taal volcano for the past 24 hours. The agency also observes a weak emission of 30-meter steam-laden plumes from the volcano's gas vents. Taal volcano is still under alert level 2, which means that a steam-driven eruption can possibly happen. And for more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.